Hello everyone, my name is Sharmila. Today I'm going to present my e-portfolio on aerobic exercise reduce insomnia among second year FPSK students of UMS. Before I start presenting, I would like to go through my biodata with you. I'm a second year biotech student studying in University Malaysia Sabah. One of my most favorite exercise is yoga. Yoga actually helps me to keep my mind calm and my physical body fit. I hope here I can find people with same interests as mine and I look forward to get along with them. The reasons for me to choose this essay title is that I want to understand and get to know people suffering from insomnia because I have been through my friends in my university where majority of them are actually battling with this issue. And also, I want to suggest exercise as one of the most promising solution to cure insomnia. I want people to see insomnia as a serious problem because many of them are really unaware of it. Before I start on my academic writing, I carry out a survey on second year FPSK students of UMS, and I found out that majority of them were 65.2 percentage of them suffered or experienced insomnia before. We can clearly see that majority of them, which is 73.9 percentage of them, do not carry out aerobic exercises regularly. In my academic writing, I suggested aerobic exercise as a solution to cure insomnia. Here are few studies given as evidence to show that aerobic exercise do reduce insomnia and improve sleep quality. First of all, what causes insomnia? Lack of sleep is one of the causes to insomnia. Lacking of sleep results in circadian misalignment. This circadian misalignment can be cured by carrying out exercises. So, these aerobic exercises can tune the rhythm where the circadian system can be back to normal. The process of increase in temperature and drop of temperature through exercises promote good sleep. The strength of this solution is that aerobic exercise is the most common solution for people suffering with both mild and critical insomnia, and it is also suitable for all ranged people. Moreover, this aerobic exercise is a natural healer for insomnia and also free of charge. In exercise not only turn down insomnia, but it the weakness of this solution is that this exercise can be divided into two: moderate and high intensity exercises. To those who carry out high intensity exercise in the evenings, take a longer time to fall asleep, whereas a person who carry out moderate aerobic exercises in the evenings before bedtime tend to get a very good sleep in the night. A very good sleep means a deep sleep. Deep sleep is where the brain and the body get a chance to rejuvenate. Thus, it is recommended to carry out moderate aerobic exercise compared to high intensity exercises in the evening or before 1 hour of bedtime. In conclusion, exercise does help to reduce insomnia problems, and it holds a great promise to improve a good sleep quality in insomnia patients. That's all from me. Thank you for listening to my presentation.
Hello everyone, I am Rosita. I will present to you my e-portfolio. This is my essay title, which is Practicing Sleep Restriction Therapy to Prevent Insomnia Among Second Year FPSK Students of UMS. Before I discuss my essay, I would like to introduce myself. I am Rosita Limanis, a second year student of UMS and currently taking industrial chemistry program. I like to cooking and hiking during my leisure time. The reason I choose this essay title is I had experienced an acute insomnia before this, which is during my matriculation study. So I want to do some reading and research about methods on preventing insomnia. So before we go to my solution, I would like to discuss my artifacts. So I came across with these three artifacts during my research. The first artifact is about the two processes that responsible to help us to fall asleep, which is circadian rhythm and sleep pressure. Meanwhile, the second artifact is about the research that conducted among medical and paramedical students in Jordan to study on how they get insomnia. In this artifact, researchers made an effort to recommend students the way to prevent insomnia by increasing an awareness of good sleep quality and hygiene. The last artifact is about the history of insomnia gene that will cause people have difficulty to sleep. So we move on the solution, which is to propose a way in practicing sleep restriction to prevent insomnia among students. There are ways which are students must build up their sleep pressure by avoid to sleep at daytime and go to bed early. Besides, students can apply a technique to reduce the time allowed to be in bed to sleep that known as sleep window technique. So by practicing these both ways, students can be strict on their sleep in order to cure the insomnia disorder. So I think the solution is stronger since it can give a long-lasting effect and also can be a stand-alone treatment. However, the solution still have some weaknesses as this therapy need to take a long time to alter students' sleep schedule. And this solution also not applicable for those that have a health problem such as sleep disorder breathing because it can worsen their health. So to conclude, insomnia can give a negative effect for students, so it should be prevented earlier before it becomes worse. I believe that sleep restriction therapy can be the one effective solution to cure it. So that's all from me. Thank you very much for listening me, and I will close this presentation. Thank you.
Hello everyone, welcome to my Google Meet. Today I will present about my eportfolio. So this is the homepage of my eportfolio. This is the basic info of myself. Firstly, let me introduce myself. I'm a second year student at University Malaysia Sabah. I am from the Faculty of Science and Natural Resources and currently taking geology as my main course. I really love to travel because of the fun memories that I can make and treasure with my friends and family. And aside from getting to know the world better, and because of that, I need to improve my English skills so that I can communicate more with people around the globe. So our group picked health as our theme, and we choose insomnia. And this is my solution. So the reason for choosing this as a title, firstly, insomnia is a common health problem for students nowadays, especially medical students. I had experienced a period of having insomnia too during my early dormitory life, like when first I stay in matriculation. Lastly, I try to find the causes of insomnia and how to overcome it. So let's move on to the solution. So as I said before, this is the solution. This is the solution to create a restful sleeping environment to prevent insomnia among the second year medical student of UMS. Sleep environment is simply the space in which you attempt to sleep, and we want our sleep environment to be as comfortable as we can. So there are few factors that you should consider, like noise, lighting, comfort, temperature, and gadgets. I get these ideas when I do my research and found this journal on the web. This journal shows 5 factors to create an optimal bedroom environment for sleep. It is from the Very Well Health by Brandon Peters. The I the artifacts and reflections. I also found this video on YouTube related to my solution from the Sleep Council on how to create the perfect sleep environment. So that's it, my artifacts and reflection. Let's move back to this. So you must consider these 5 things so that we can achieve our goal sleep environment. Mm, There is a few, there is strengths and weaknesses of my solution. I think the strength of my solution is it can be done by any student because it doesn't matter if they stay in the university's dormitory or rent house or an off-campus apartment. They can design and arrange their room according to their preferences and likings. The weaknesses of my solution, however, especially when for those who stay in campus apartment, a campus dormitory, we always share room with our roommate, right? So not everyone has the same preferences with us, and difficult that make it difficult to design the room the way we like because maybe others don't like that. So the conclusion. So I think that's all from me about the presentation. I hope it is clear and thank you. That's all from me. Bye.
Hello everyone. Today I would like to present about my portfolio, which is light therapy treatment reduces insomnia among FPSK students. Let me tell you about myself. I'm Sharmila Arasu and my metric number is BN18110038 and I'm majoring in food technology and bioprocessing from the faculty of FSMP. Why do I choose this essay title? It's because it relates to health, and I'm very concerned about my health. And it interests me to do an exploration about insomnia. I am able to lend a hand to help my friend and UMS students who are suffering from insomnia. Moving on to my artifacts and reflection. Insomnia usually happens when you are stressed, overthinking, lack of rest, and overload works. Uncomfortable pillow also can cause insomnia because even me, when the pillow is not comfortable, I couldn't sleep. Meditation, balanced diet meal, and a healthy lifestyle can also prevent insomnia as it reduces stress and also it gives you a productive day. Our body is influenced by light. We wake up when it's bright and we fall asleep when it's dark. But people who are suffering from insomnia, they tend to stay awake at night and sleep during the day. So this therapy helps to sync your body clock to have a good sleeping pattern. And moving on to my final essay. The solution for this issue, which is insomnia, would be light therapy as it reduces the production of melatonin to promote good sleeping quality and resynchronize sleep pattern with day and night cycle. It is suitable for the sun and it is a successful treatment to reset your body clock with regular use. The body produces melatonin naturally and helps to promote good sleep when the melatonin level rises in the evening as the production of melatonin is affected by light. There is evidence that melatonin can reset the body clock. Researchers propose that fasting for about 16 hours aids in resetting the sleeping clock for humans and reduces jet lag when traveling across time zones. And the solution can be solved among FPSK students. And it is also advisable for them to consult lecturers or attend counseling program that is usually conducted by psychology students in the UMS. And this therapy synchronizes the body clock by uncovering the eyes. And researchers also suggest that light therapy can be effective in treating insomnia. This treatment needs to be consistent process and properly timed. Students who are suffering from a history of skin cancer, sensitive skin, and eye problems are not suggested to undergo this treatment. In short, this therapy is effective and inexpensive, and it is also safe and convenient. The faculty can use this light therapy treatment to students who are suffering from insomnia. It also improves their performance in their academics as well as to be more active in classes. This therapy will encourage you a normal sleeping pattern. Insomnia can be a serious issue if this prolongs and may get worse. The faculty should be more concerned about this matter as it concerns the performance and health of students. That's all from me. Thank you for watching my video. Have a nice day. Bye.
Greetings. I'm going to start my presentation by doing an introduction of myself. My name is Muhammad Rizky bin Hairuddin. I am a second year student at University Malaysia Sabah and currently majoring in international business. I have a deep interest in video games and esports as a hobby. This semester, I took academic reading and writing to improve my English personally. The subject looks promising so far as I have learned a few new things throughout the learning sessions. For the task given, I've chosen the topic insomnia among FPSK students. There are a few reasons on why I'm choosing this problem or issue to study. For starters, I'm a university student that often struggling with insomnia on daily basis. Next, I'm trying to find out what are the causes of insomnia among people, especially students. In addition, I'm also trying to figure out how to combat or overcome the aforementioned problem so we can finally have a good and stable sleep routine. And now, I'm going to talk about my essay. The essay will discuss the causes of insomnia among FPSK students in UMS while proposing a solution, which is participating in cognitive behavioral therapy, or sometimes called CBTI. Before we're going any deeper into the topic, let's take a look on my artifacts because the artifacts are some of the resources that I used to write these essays. Insomnia in general is the world's common sleep disorder that can affect anyone, no matter their gender, age, or their physical or mental condition. When I came across this video called What Causes Insomnia by Dan Quadler, it helps me to understand some of the major causes of the problem. The presenter of the video also mentioned that stressing on unfinished work and pondering deep questions were seemingly unsolvable loop that became the heart of insomnia. Next, I was also inspired when I stumbled upon this interesting podcast called Daily Insomnia Podcast, where two guys share their experiences or stories and discuss about insomnia within multiple settings with some comedic touch. Lastly, this article I discovered shed some light into sleeping problems in university students. The researcher break down some of the famous insomnia causes and how to combat it. They conduct the study with a few instruments such as actigraphy and found out that a whopping 74% of their participants reported symptoms of insomnia disorder. So, my solution is using cognitive behavioral therapy or CBTI because it is an effective treatment for chronic sleep problems and is usually recommended as the first line of treatment. It is a structured program that helps you identify and replace thoughts and behaviors that cause or worsen sleep problems with habits that promote sound sleep. Unlike sleeping pills, CBTI helps you overcome the underlying causes of your sleep problems. Scientific reviews and meta-analysis show that CBTI is very effective. The strength of this solution is it teaches you to recognize and change beliefs that affect your ability to sleep. This type of therapy can help you control or eliminate negative thoughts and worries that keep you awake. It is also helps you develop good sleep habits and avoid behaviors that keep you from sleeping well. It also does not cause bothersome side effects. On the other hand, there are a limited number of certified behavioral sleep medicine specialists, and you may not live near a practitioner. You may have to do some searching to find a trained practitioner and a treatment schedule or type that fit your needs. All in all, CBTI can benefit nearly anyone with sleep problems. It can help people who have primary insomnia as well as people with physical problems such as chronic pain or mental health disorders such as depression and anxiety. What's more, the effect seems to last. and there is no evidence that CBTI has negative side effects. It requires a steady practice, and some approaches may cause you to lose sleep at first, but stick with it, and you will likely to see the lasting results. So, thank you very much for listening, everybody. I hope it was of value to you, and with that, I will end my presentation. Thank you.